The importance of partnerships is it's always a win-win. And if you really sit down with the local VA, what services can you bring to us? What can we provide to you to facilitate that?
I was suffering a lot of memory loss. It was actually from 4 TBIs that I had suffered over the time starting when I was in the military. Because I was in constant pain all the time. It was really bad. So the chiropractor said, hey, we have this new program. It's going to be the aquatic program. I think you would benefit from it. I kind of rolled my eyes because I'm a diver and I have 5,000 dives in my dive book. But I was in such bad pain at that time I would try anything. Big smiles, everybody, big smiles. So it was a 10-week program and I made it through. I dropped 85 pounds over a year's time because of the aquatics and being able to get back in the gym.
To get other veterans within the community and other folks within the community engaged with veterans, Rob's a good example of veterans helping other veterans and how veterans can get engaged.
The hospitals can only do so much because we don't have every veteran in the community coming into the hospital. And when they do come in, we can't reach them all and tell them, you know, I can only grab so many veterans when they come in. My committee's trying to do now is use our service organizations to reach out to more veterans so we can spread the word about the whole health and use the organization as peer support groups to get the whole health out to more veterans that way.
Community involvement is critical to the success of veterans because, you know, we all know that, you know, it takes an entire community. It's important to work with our community partners to ensure that they have a continuum of care.
Whether you're 40 when you're getting out or 20 when you're getting out, you're kind of left hanging. If we can partner up with like YMCAs, church groups, other social clubs, and use them all, because not every veteran when they come out of the military or when they're getting out of the military comes to the VA right away.
So our hope is in going out to those organizations and speaking to them and presenting to them is that as they go to their other functions in their daily lives is that they talk to the other veterans and the message just gets passed from one to another and it's going to grow our mission in whole health in terms of helping the veteran achieve what they want their life for.
And I have a quality of life that I didn't have at that point. And the biggest thing I get out of this is now when I'm teaching the other veterans is I see them 6 months down the road or a year back down the road, they come up and hug me because it changed their lives. And so the biggest thing I get now out of the whole health program is changing another veteran's life.